In terms of vaccinating the youngest pediatric population against COVID-19, the news so many parents and pediatricians have been waiting for, the emergency use authorization of 2 vaccine candidates for this age group will tell you everything you need to know and what's known at this time, as well as what's not known. One of the most common questions I've been getting is, should I vaccinate my baby, my toddler, my child? Assuming that these vaccines receive emergency use authorization from the FDA and then granted and moving forward after the CDC approves that, it's really a discussion that parents should be having with their child's pediatrician. We have to go by what we learned from the clinical trials. That's publicly available information. And then risk versus benefit needs to be individualized between the child's pediatrician and the parents. There have been hundreds, unfortunately, of COVID-related pediatric deaths. The risk is lower than that of older populations, but the risk is not zero. And it's not just the risk of death that parents and pediatricians are concerned with. It's the risk of infecting someone else, either another child or adult who may be more vulnerable, more at risk for serious complications and or death from COVID-19. It's the risk from being out of school or work for a prolonged period of time. And it's the risk of long COVID or post-COVID syndrome, which could be significant and unknown at this point. The one thing that is really important is whether you decide to give your child the Pfizer vaccine or the Moderna vaccine, the dosage regimen is very important to adhere to. For example, Pfizer is a 3-dose regimen. After 2 doses, the efficacy really is not there. So this is the same principle as with adults in adult medicine. Dosage regimens, whether it's for vaccines or medication, exist for a reason. That's what's been tested, that's what's been studied, and when you look at safety and efficacy, that is the regimen or the methodology that's been used. Right now, according to the CDC, the FDA, and experts in the world of pediatric infectious diseases, we do not yet know enough to say that one vaccine manufacturer is superior to another. The bottom line is they both provide some degree of efficacy against COVID-19 illness, and so vaccination in general is recommended. What about side effects when you talk about what did we learn from the clinical trials of children as young as 6 months of age up to 5 or 6 against COVID-19 using these vaccines? There were no serious safety signals in clinical trials using these vaccines, even in babies, but the typical and common side effects that have been seen or could absolutely be seen: pain, swelling, redness at the injection site, some sore arm. Some children will get a little bit of irritability, maybe a low-grade fever or temperature, headache, some body aches, or some nausea. A lot of times the vaccine will need to be given in the thigh instead of the arm. Not every pharmacy will have the training or experience to be able to implement that, so therefore it may fall more on the pediatrician's offices in terms of the where of how to vaccinate these youngest children. According to the vaccine manufacturers, any child who's had a serious allergic reaction to any of the ingredients in the vaccine should not get this vaccine. If you have concerns about any possibility of an allergic reaction, obviously you absolutely should discuss those questions and concerns with your child's pediatrician.